Medication side effects can have a significant, yet often overlooked, impact on skin health. While medications are essential for treating various medical conditions, certain drugs can produce unwanted skin reactions that range from minor irritation to more serious complications. These side effects can manifest in various ways, including dryness, heightened sensitivity, rashes, and photosensitivity, which collectively compromise the skin's health and appearance. The more severe effects can accelerate the skin's aging process or exacerbate existing skin conditions, making it crucial to understand the potential dermatological risks associated with certain medications. Dryness is one of the most common skin-related side effects of many medications. Drugs like antihistamines, diuretics, and certain acne treatments, such as isotretinoin, are known to interfere with the skin's natural moisture balance. These medications often reduce the skin's ability to retain water, leading to dehydration and the appearance of dry, flaky skin. For individuals already struggling with conditions like eczema or rosacea, the added dryness can exacerbate symptoms, making the skin more prone to irritation and inflammation. In severe cases, the skin may become so dry that it cracks or peels, creating an uncomfortable and unsightly appearance. The prolonged use of medications that cause dryness can also lead to the development of fine lines and wrinkles, accelerating the visible aging process. Sensitivity is another common side effect of many medications. Drugs that alter the skin's barrier function or affect immune responses can increase the skin's sensitivity, making it more prone to irritation, redness, and itching. For instance, corticosteroids, commonly prescribed for inflammatory conditions like asthma, eczema, and arthritis, can thin the skin over time, making it more vulnerable to environmental stressors such as pollution, wind, and harsh weather conditions. This heightened sensitivity can also make the skin react more intensely to certain skincare products, causing discomfort or even allergic reactions. Individuals who are on medications that increase skin sensitivity may find that their usual skincare routine becomes problematic, as products that were once tolerated may now trigger irritation or inflammation. One of the more concerning side effects of medication is photosensitivity, which refers to an increased sensitivity to sunlight. Certain medications, including antibiotics like tetracycline, some antihistamines, nonsteroidal anti-inflammatory drugs, NSAIDs, and chemotherapy drugs, can make the skin more vulnerable to the harmful effects of ultraviolet, UV, radiation. Photosensitivity occurs because the medication alters the skin's response to light, making it more prone to sunburn or sun-induced damage even with minimal exposure. This heightened sensitivity to sunlight can lead to redness, blistering, or pigmentation changes, which can be particularly problematic for individuals who need to spend time outdoors for work or leisure. For those experiencing photosensitivity, the risk of sunburn becomes much higher, even on cloudy days or during short periods of sun exposure. In severe cases, this can lead to painful blisters or peeling skin. The long-term effects of photosensitivity include an increased risk of premature aging, including the formation of wrinkles and age spots, as well as a heightened risk of developing skin cancer due to repeated sun damage. It's important for individuals taking medications that cause photosensitivity to take extra precautions when spending time outside. Wearing broad-spectrum sunscreen with a high SPF, protective clothing, and seeking shade are all essential measures to reduce the risk of sun damage. In addition to these common side effects, certain medications can also cause more severe or systemic reactions that affect the skin. For example, some blood pressure medications like ACE inhibitors are known to cause angioedema, which is swelling beneath the skin, particularly around the eyes and lips. Other medications can trigger allergic reactions that result in hives, rashes, or even life-threatening conditions like Stevens-Johnson syndrome, which causes severe blistering and peeling of the skin. Although rare, these serious reactions can have lasting effects on skin health and can lead to permanent scarring or disfigurement if not promptly treated. The impact of medications on the skin can also be influenced by underlying medical conditions. For example, individuals with autoimmune diseases or chronic conditions such as lupus or psoriasis may be more susceptible to certain medication side effects. These conditions can already make the skin more sensitive, and the use of medications to treat them can further compromise skin health. Additionally, some medications used to manage chronic illnesses, like immunosuppressants or chemotherapy drugs, can weaken the skin's ability to defend against infection, making it more prone to rashes or other skin conditions. One of the most challenging aspects of managing medication-related skin issues is that they can vary significantly depending on the individual and the type of medication. Some people may experience only mild side effects, while others may suffer from more pronounced reactions that require medical intervention. It's also possible for side effects to develop over time, meaning that a medication may not cause any issues initially but can lead to skin problems months or even years down the line. This makes it crucial for individuals taking long-term medications to monitor their skin health and consult with a healthcare provider if they notice any changes, such as persistent dryness, increased sensitivity, or signs of photosensitivity. If you are experiencing skin issues as a result of medication, it's important to consult with a dermatologist or healthcare provider who can help manage and mitigate the side effects. They may recommend adjustments to your skincare routine, suggest topical treatments to alleviate dryness or irritation, or even explore alternative medications that may be less likely to affect your skin. Additionally, they can provide guidance on how to protect your skin from sun damage if you are taking medications that increase photosensitivity. In some cases, switching to a different medication may be necessary if the skin reactions become too severe or impact your quality of life. It's important not to stop taking any prescribed medication without consulting your healthcare provider first, as this could negatively affect your overall health. However, a healthcare provider can work with you to find solutions that minimize skin-related side effects while still addressing your primary medical condition. In conclusion, while medications are crucial for managing many health conditions, they can also cause a range of skin-related side effects, from dryness and sensitivity to more serious issues like photosensitivity and allergic reactions. These side effects can compromise the skin's appearance, accelerate aging, and make the skin more vulnerable to environmental stressors. By being aware of these potential risks, individuals can take steps to protect their skin, such as using appropriate skincare products, applying sunscreen regularly, and seeking medical advice if skin problems arise. Through proper care and attention, it is possible to manage the skin side effects of medications and maintain healthy, vibrant skin.